Behavioral health complaints are some of the most common that we see in the primary care setting. Up to 20% of adults in the US might have a behavioral health diagnosis like depression or anxiety. Sadly, less than half of those people will actually get the treatment they need for depression or anxiety. The main kind of depression is major depressive disorder. This is when you've had persistent symptoms of depression, which includes things like low mood, not enjoying the things that you previously enjoyed, low energy, difficulty concentrating, changes in your appetite, thoughts of hurting yourself. Those symptoms, if they're around for more than 2 weeks, typically mean you meet the criteria for major depressive disorder. You might also have some variations in your mood depending on the season. This is called seasonal affective disorder. New moms might have changes in their mood. This is called postpartum depression. Or you might have symptoms that are more likely due to anxiety. So when your doctor is evaluating you for depression, he or she is going to go over the different symptoms that you have. This allows them to evaluate whether you meet criteria for depression or whether your symptoms are due to something else. This may be due to another behavioral health diagnosis, like anxiety for instance, but it could also be due to a medical problem. For instance, low levels of thyroid hormone could result in depressed mood, sleepiness, fatigue, some of the symptoms that overlap a lot with depressive disorder. If you're feeling depressed, know that there is a way to get out from under those dark clouds. There are a lot of good treatments for depression, including both therapy, like cognitive behavioral therapy, or medications, like antidepressants. So I do think it would be very helpful to talk to a physician to learn about whether you meet the criteria for depression and what kind of treatments will be best to benefit you. If you think you have depression, download the K-Health app. There you can learn about how people like you were diagnosed and treated. You can also connect with one of our doctors in real time and learn about different treatments for depression.